Good evening, ladies and gentlemen. I am Dr. Rajesh Majumdar Chowdhury. I am an oculoplastic surgeon practicing in Kolkata. One of the major oculoplastic problems that we face in our day-to-day practice is watery eyes. We find that these group of patients come in two age groups. We have very young patients in their first year of life who come with watering eyes, and then again another group who come post 50. The patients who come in their first year of life, the parents would come and complain that the child is having watery eyes, and we find that this problem is usually due to a congenital problem with the tear duct. Most of these patients recover quite well with antibiotic drops and massage along the tear duct, and usually we do not need to do anything for them at all. However, a small group of patients, this young age group patients, can sometimes need a procedure called a probing and syringing. We have quite a few of these patients. We find that our outcome of the probing syringing is quite good. The other group of patients that we have are of slightly older age. They're mostly female, and they're present with watery eyes with discharge. These group of patients have a problem which has started in the adult life, and when we examine these patients, we find that they have actually a blocked tear duct. Why this blocked tear duct happens? There are a lot of theories, but I think an environmental factor cannot be denied. Also, there is a school of thought which says that as we get older, we kind of hear less, we kind of see a bit less as well, especially for reading vision. Similarly, the tear ducts also undergo some kind of involutional or age-related changes leading to narrowing of its aperture. This, in addition to the environmental factors causing nasal inflammation, can give rise to blockage of the tear duct outlets in the nose. These patients in the initial stages can be managed quite nicely with antibiotic drops. However, if they cross a certain threshold where they have regurgitation of pus and mucoid fluid on pressure over the lacrimal sac area, then usually they need surgical treatment. The surgical treatments that we usually do for these patients can be a particular type where we create a bypass channel whereby the water from the eye can flow very easily into the nose and thereby then get in the throat. Or in some cases, especially in really old patients or who have other medical problems which precludes them from having any major surgery, we can remove the sac in total. The first type of surgery is called dacryocystorhinostome, and the second type of surgery is called dacryocystectomy. In the first group of surgery, what we do is we remove a piece of the bone, nasal bone, and we create a bypass channel joining the nasal mucosa as well as the sac mucosa. The water flows quite easily through the sac into that new channel and then into the nose. So these patients are freed of the trouble of watery eyes as well as they do not have any sticky discharge at all. In the second group of patients where we have performed an excision of the sac, these group of patients also do not have any pussy discharge, but they do have watery eyes. Nowadays, we usually perform this kind of surgery where we have performed a bypass channel and the patients are freed of both the symptoms, that is watery as well as sticky discharge. Some patients come to us who have had the second group of surgery, the BCT surgery or the dacrylocystectomy done in the past, and now they want to have a reversal because they are not very happy with their watery eyes. In those kind of patients, we can perform some reversal surgery, and most of these patients go back happy with us. There are some patients again we have who come to us with surgery done previously in other centers, and unfortunately this surgery has failed. And for those kind of patients also, we have certain ways whereby we can decrease the watering eyes. Generally, we get to do about 4 or 5 this kind of surgeries every week, and at the end of the year we perform an audit of our surgical results. We find that our surgical results is about 97 to 98% success rate. The remaining 2 to 3% patients may need further surgery in the future. Thank you so much.